Hi, I'm Todd Goins. I'm the director here at Clay County Department of Social Services, and I appreciate you joining us today. I want to let you start by saying that here at DSS we offer a wide range of programs, work with a good group of people, and our whole purpose is to serve the citizens of Clay County. We serve citizens from newborn all the way to death in Clay County. So our number one mission is to ensure that our most vulnerable citizens are cared for, that they're safe, they're protected. We also want to strengthen and support individuals and families, and we promote independent, healthy living. So our staff here, we're committed to a team approach to serving the citizens of Clay County. We want to offer the services in the most effective, most efficient way possible, while ensuring that all citizens receive these services in a professional and courteous manner. Here at DSS, we are accountable to federal, state, and local laws and policies that kind of govern how we go about doing our job. We're accountable to our Clay County leadership teams. We're accountable to the citizens that we serve in Clay County. And we're accountable to each other, to our team. And we're accountable to ourselves to do the job well and to serve our community well. We are a community agency. We're only one community agency. We work with a great group of other agencies here in the community. We have a strong network. So if we can't find the answers, we work to try to help you find the answers. There's a lot of misconceptions or preconceived ideas about DSS. Depending on what your interaction has been or what your family's interactions have been. But I would want you to know that we are here to serve. We're public servants, we're paid for by the taxpayers, and it's important to us that we do our jobs well and that you get good service. So in just a few minutes, you're going to hear from the rest of our team here, our leadership team, who are going to talk about the programs that they supervise. And it's a great group of people. So if you ever need anything, feel free to pick up the phone and call, and we will do our best to serve you. Thank you.
So I'm Haven Phillips, and I work at Clay County Department of Social Services. I supervise intake assessments and in-home services, and we kind of call that Child Protective Services, the Child Welfare Services here at our department. And the first thing I'll talk about is intake, which I think is probably going to be one of the most important things for everyone to kind of know, is that when you do have concerns about a child, you contact us and you can make a report if you are worried about a child. It doesn't necessarily have to be, I know a lot of people think, okay, it's just physical abuse or sexual abuse, like the big serious ones. There's also what we more often get involved in is with like neglect, like if there's domestic violence going on in a home, or if there's an issue like with a child receiving everything that they need to meet their basic needs that might be impacting their safety. So if you have any concern at all for a child, you're welcome to call our office and make a report. You would talk with a social worker who will ask you some questions, and then we will then follow our policy to kind of screen that report to see if we need to be involved or not. And we encourage people, even if you don't think that it's something that might meet our criteria, that's fine. We can also answer questions about anything that a family might need as far as like resources, because our goal is really to help families. It's not to remove children. I know there's that perception out there of DSS and that stigma around it, but that's not our purpose. Our purpose is to make sure that children can remain safely in their home, and while we're involved, really meet any needs that we find that a family might need and connect them to resources. So if we do get involved and we do screen in a report, then it moves on to like the next level, which is assessments or investigations. And so we go out and we meet with the family. We meet with the children. We talk to people that are involved with the family. Our first goal is, of course, to assess safety of the child. That's our number one priority, but we also do a global assessment of the family and see what might be things that they need. It might be connecting them to resources to help pay a light bill, or they might need daycare, and so we can make a referral to child subsidy. And if we're involved, we have the ability to make a referral for child subsidy regardless of income to help get them connected. So there's a lot of different things that we can do at that stage to help a family. And if we do identify needs that impact child safety, then a lot of times we consider that family for what we call in-home services. And so the purpose of in-home services case management is to work with the family for 3 to 6 months to make sure that we can address the safety concerns, but also connect the family to all the resources that they need to keep that child safely in the home. And we're really big on preserving family units together. It's really a last effort. Like, we don't like to have to file for custody, but if we have to, we try everything beforehand to meet those outstanding needs so that the child can stay with their families. But while we're involved, we're constantly assessing for safety and constantly seeing where can we help, where can we fill in those gaps and those needs for families. And that's kind of what I do on my side, and our social workers, who are amazing. They're really good to work with families and connect to services. And even if we're not involved on that level, you can always call and ask us if there is anything that you need, and we don't mind to kind of point you in the right direction.
Good morning, I'm Mary Ann, and I work with Clay County Department of Social Services, and I supervise economic services. Economic services includes food stamps, Medicaid, child support services, energy, non-emergent medical transportation, program integrity, and another program which I don't supervise but that we do have is child care subsidy. And I will just give you a brief breakdown of each one of these programs. Food stamps, basically, the income level is 0 to 200% of the federal poverty level. The case is based on income, household size, many variables such as, is there a drug felon in the home? Are there illegal aliens? Does someone share 50-50 custody of their kids with an absent parent? Are you paying on medical bills? So the best way to determine food stamps is to go ahead and apply and let the caseworker review your case, because every case has some variables. Every case is different. And let them determine if you should be receiving a food stamp benefit. Child support services, we provide child support services to both custodial and non-custodial parents. We do not prefer one side or the other. It's all about the child, and each child has the right to be supported. There's no income limit to apply for child support services, and we can assist in establishing paternity support and enforcing those child support orders as well. But like I say, we provide services to both parents, the custodial parent as well as the non-custodial parent. Energy, we have a crisis intervention program and a LEAP program that can help with energy bills throughout the winter time. The income limits are up to 150% of the federal poverty level. I won't be getting into details of the income limits for each of these programs because there's too many variables for each program and really too many income limits. So we simply don't have the time to get into that on this presentation. Non-emergent medical transportation. This is something that if you are on Medicaid, you could receive assistance getting to your doctor appointments, to hospital for medical tests, to therapy, pick up your prescriptions. You would just need to call and see if you're eligible for the non-emergent medical transportation. And this is non-emergency transportation only. Obviously, if you have an emergency, you would call 911. Program integrity was essentially put on hold during the pandemic. Program integrity is a program in which we investigate fraud, Medicaid fraud, food stamp fraud, any type of fraud. So if you've had changes and haven't reported those, or just weren't totally forthcoming on your application, you could be referred to the Program Integrity Unit to see if there is any fraud there. And there could possibly be a payback. Medicaid. We could spend days talking about Medicaid. Medicaid has many subcategories. Medicaid for the aged, blind, and disabled. We have Medicaid that can pay Medicare premiums. We have long-term care, which could potentially help pay for nursing home care. MXP, the new Medicaid expansion program. MIC, which is Medicaid for infants and children. MPW, Medicaid for pregnant women. MAF, which is Medicaid parents could potentially be eligible for by meeting a deductible. TMA, which is transitional Medicaid. And family planning, which provides services in regards to family planning, birth control services, and that type of thing. That's administered, the actual family planning program is administered at the health department. For any of these programs, you can apply in person, by phone, or you can apply online at epass.nc.gov. It is important to attach all the information that application requests. If you do so, your application can be worked in a more timely manner. Any applications time limit range from 25 days up to 90 days and beyond. It depends on the program you're applying for and the situation. You can also send an application to Medicaid at claydss.us. You can apply at healthcare.gov, and you can get a lot of information on any of our economic services programs at ncdhhs.gov. And you can always call us here at Clay County DSS at 828-389-6301, and we'll be happy to speak to you.
Hey, I'm Courtney Robertson. I am a supervisor of Permanency Planning Services as well as licensing and adoptions here in Clay County. So permanency planning, most people know of that as foster care services. And so when the agency takes custody of a child, then it comes to me and my unit. And with foster care, we are working reunification with the families. We're trying to get those kids back in the home. So initially we are working with the families on their direct needs and whatever the reason was that the child came into care, and we're help link them to resources, help support them. A lot of people think of foster care as, you know, they think negatively about DSS and think negatively about foster care, but really we can be your biggest cheerleaders. So we really are tickled when families do well, and we want to encourage them to do well. There are hard times, but there are good times, and our best days are those days that we can reunify or help a child find permanency. Permanency can also be custody or guardianship with other family members or people who, are familiar with a child, or adoption. And so within our agency, we also do adoptions. So if you are interested in adoption and feel, like you could help make a difference in a child's life, please reach out to us and we can connect you with our licensing worker. Even if you're maybe not sold on becoming licensed and becoming a foster home, there are so many things that you can do just to even support our foster families, support the children, even do respite, do a day out with a kiddo. So there are plenty of things that everyone in the community can do to kind of give back and help support these children. In addition, we also, right now currently in Clay County, we have about 24 kids in care, and we have 5 who are in what we call an 18 to 21 program. That program supports those kids who are aging out of care, because normally, even when I was 18, I was not ready to be out on my own. A lot of these kiddos, when they turn 18, they don't have as many supports as a typical 18-year-old would have. So the 18 to 21 program is there to kind of wrap around them and provide support, keep them connected to resources, and just help them through those life skills that they may still be learning. So in addition, we've got, I think I mentioned we have 24 in care and 5 in the 18 to 21 program, and we have kiddos of all ages, so babies all the way up to 18 to 21. So there are always ways that you can jump in and help. If you're interested, just reach out to us.
Hey everyone, I'm Kayla Nelson and I'm the Adult Services Supervisor here at Clay County Department of Social Services. Under the Adult Services umbrella, we have several programs that we offer to elderly and disabled adults in our community. The biggest thing we do is Adult Protective Services investigations. So if someone has concerns of abuse, neglect, exploitation, or self-neglect of an elderly and disabled person in our community, we investigate that and can provide services if those claims are substantiated. Everyone in the state of North Carolina is a mandated reporter. If you suspect that, you would call our office at 828-389-6301 and ask to make an Adult Protective Services report. We also have several other programs that we offer to help adults stay safely in their homes. Those are the In-Home Aid Program, the Community Alternatives Program, and the Consumer Directed Program. Each of those programs have various income requirements and household requirements, so you would just call the office here to see if you qualify and to get a referral to be on the wait list for those. But each of those programs in their own way offer housekeeping, personal care, different things to keep adults in their homes and safe. We also offer a special assistance in-home program, which can provide seniors with a little extra money each month to, again, help them stay safe in their homes. Also under Adult Services is our payee program, where we can become payee for adults on Social Security to help them manage their money and make sure that their bills are paid on time. We offer guardianship services for adults who may need a guardian to help them make decisions to remain safe. We also do care home monitoring. So the only care home in Clay County is the Hayesville House, but we monitor that quarterly to make sure they're meeting requirements. And we also investigate any complaints against the care home if there are any. We also have veteran services under Adult Services here at DSS, and our Veteran Services Officer helps veterans in Clay County get the benefits that they're entitled to as a veteran. Mainly their pay that they can get if they're a disabled veteran. We also have cash programs here, Emergency Food and Shelter Program and the Emergency Assistance Program, which can help pay a certain amount of money up to rent or past due utility bills. Those also have income requirements, so you would just call the office here if you had any questions, if you needed help to see if you qualify. We also have the Hearts for Kids and Seniors program, which is a nonprofit that people can donate to, and the money that is donated to that goes to help kids and seniors in our community to buy things that they may need that they otherwise wouldn't be able to. And also under adult services at DSS is the senior center. So it's not located here in the DSS building, it's at a different location. But they offer Meals on Wheels, they offer congregate meals, they do different activities every day. They're open Monday through Friday. And the number to the senior center is 389-9271 if you had any questions about services that they offer.